One of the things that I'm doing with my research lab is that we're trying to convert a lot of the good stuff or the potent mechanisms of the treatments that we use here into online formats and formats that require very little therapist exchange with individual patients, so that it's more accessible, affordable, and sustainable for our field. I've been talking to a lot of clinicians because I supervise a lot of people in administering these treatments, these psychotherapies. And what I say is that there's a process of translating this knowledge, the facts about this treatment and the patients that you're treating, into wisdom. And I think it's really wisdom that gets conveyed between people that helps people grow. And you know, I'll tell you that all the things I really most learned from my mentors like Salman Akhtar, Skip Pope, John Gunderson were not the facts. I could learn those on my own, but what really mattered to me was their wisdom, those things they said more spontaneously. For example, John would tell me when patients got really angry at him and I was a bit taken aback by it, he said, "Oh, they just are angry because they care about what I have to say," which I thought was a very interesting twist on the situation and my interpretation. Or he would say, "They're angry because you didn't give them what they wanted." And it really detoxifies the read we have on things. So these pieces of wisdom, whether they're packaged in people like John Gunderson or in treatment strategies, I think they even out our view of some sort of situation we're in, so that we feel like it's less like a fire that we can't touch or a threat that we have to attack. And so I do think that all the treatments work in different ways, but there's no proof that the reason they work is specific to what they're doing. Because we know there's many, many treatment approaches that now have been proven for borderline personality disorder. And in my efforts to debrand it, it's not to try to tear down these treatments, because I think they've made massive contributions to the field and to society. But I want to figure out what are the bare bones so that most people can at least do that. And John really did a lot of thinking in terms of boiling down all his knowledge into wisdom. He was really good at that and conveyed it in a way that most people could understand instead of using really technical terms. Because as I've always said, I think the basic limitation of some of these treatments is that they use like really highly intellectual and scientific terms to describe human problems, so that it becomes very difficult to understand how it actually translates into life outside the therapy or the group therapy. But I do think that there are common pearls of wisdom that run through all of them. And what John said is that the operative ingredients had to do with thinking first, that is, think before you do things, have goals, and organize your activities around those goals, rather than whether or not you're good or bad, or whether or not someone's there for you or not. Really think about what you want, and then do the things that you need to do them. So if you want someone to be there for you in a relationship, don't yell at them all the time. Or maybe you should do things for them sometime. Or maybe you should show them you appreciate it and collaborate with them. Those are goal-driven behaviors rather than emotionally driven behaviors. And lastly, he talked about these corrective experiences. Try to take two, you know, like as a director's cut, like try that again and see if you can have a different experience of it that allows you to have a different concept of it. When someone's yelling at you, it's because they care about the thing you're talking about, rather than that's a bad sign. And that's what we have to do all the time, is correct our ways of doing things so that they work better. And that's universal for all of us. That's what I think personality disorder treatments have to teach the world about how we all grow up as human beings. So none of the things that are taught in these psychotherapies are bad for people. most humans could benefit from using them, but people with BPD really need them because they've missed out on life a lot and they've been really confused about their life experiences and what to do with the experiences that they've had. It's the conversion of knowledge to wisdom, I guess, that they're really struggling with.
In terms of this wisdom exchange, which is like almost like an oral tradition, don't we need this like human sort of wheel to make the change? In other words, in the digital space, is it possible to, I mean, I don't think I've personally had change without this sort of wisdom wheel that's fed my heart.
Well, I think people do well with different combinations of these things, and some people do well enough without the human contact. In fact, if you think about BPD as a problem of interpersonal hypersensitivity, which I do, some people are so overwhelmed by the other person in the room that they actually do better if some of the work is done without that other person there.
Interesting.
And that's actually the concept behind DBT for PTSD. Martin Bohus's treatment is a lot of it is homework driven and self-study because the patient has been traumatized by people. So that actually empowers the person to do more thinking in their own time and space in a way that works for them, not just in the 45 minutes they have with their therapist at a time that works for the therapist. So I actually have really changed my mind about how much the therapist matters. I was struck by how much people really gained by watching the session I did with Charlotte. And feeling like it conveyed something that they also related to. And, you know, whether it's that you see something in a movie or in a book or hear it in a song that feels like it captures something that you've been through, you feel like less alone and more grounded, that that's a reality that exists in the world. And it verifies it for you and clarifies it so that you can kind of locate it and affirm it within yourself, and that gives you a more solid sense of yourself. So I think that people can be transformed by humans even without contact or individualized interaction, and every person needs to find it for themselves. One thing I'll go back to is that I think all healing interventions work through something that Bruce Wampold wrote about in Common Factors that are operative in psychotherapy. He called it the healing myth, that everybody is walking around with a folk psychology. That means just like a layperson's understanding of themselves and the world. Like one person might say, oh, the world's an okay place, some bad things happen, but I'll just amble along and mostly things will work out. That may be their folk psychology. But another person may think everything that I do is horrible and never works out and only hurts people. Or everybody in the world is horrible and they're going to hurt me somehow, so I have to minimize how much I do that exposes me to that danger. So you take these folk psychologies that are built from combinations of biological factors and human experience, and then you get involved with someone, whether it's a clergy person or a healthcare professional or a shaman or even like a psychic, and they give you a healing myth that generates a change in the way that you see the world and you see yourself. And that healing myth only works if it creates a more constructive understanding of what that person is to do with themselves and the world. And so a lot of these treatments for borderline personality disorder construct a healing myth. Like for DBT, that BPD is a problem of emotional dysregulation. You get skills, you're more effective, and then you'll live a life of normal happiness and unhappiness. Or mentalization-based treatment. You don't mentalize stably, that is, you don't understand yourself and others in social interactions in a consistent way. So you need to improve that so that you no longer have borderline. So these are ideas that we use as healing myths to replace the existing maladaptive understanding a person has that they're carrying around like baggage you know, so that everything is repeating history is repeating itself over and over again.
Right.
And I think the goal is to make that myth about ourselves constructive so that we can lead satisfying lives and do things that are good for other people around us. I mean, that's a life goal. Not everyone achieves it, and I find that a struggle every day.